of corrosive substances into the vagina. Cause, I won't be able to read this because we are limited by time, but the causes, as the chair of equality mentioned, the causes are mostly cultural. They are nothing to do with religion. In those areas where it is practiced, women are trying to please their men. So what they're doing to be accepted in their community, to be accepted in their area, they have to go through FGM. Then you can be married. Because in Africa, when you are married, you are respected, you are considered, you will be here, you will be heard. People will listen when you talk. Any girl will do her best to get a husband. And of course, a mom will do everything for her child to get married. So really it is more about culture. Consequences, as we mentioned, the instruments used, they're not sterilized. They're used on different women, different girls, so they can pass HIV through. Then shock, hemorrhage, bleeding, tetanus or spexy, bacteria infection, urinary retention, open sore in the genitalia region, and injury to nearby genital tissue. And also recurrent bladder and urinary tract infection, cyst, infertility, the need for later surgery, for example, when a woman is pregnant. In 2003, a private member's bill supported by the government was legislated and was enacted in March 2004. The amended law is called the Female Genital Mutilation Act 2003. This made it illegal to take girls who are UK national or permanent resident out of UK for the sole purpose of FGM. Maximum prison sentence was increased to 14 years. I've got an issue with this part where they're saying national, UK national or permanent resident. That means we still have other children out there who are not protected, who are exposed. So as you are here, policymaker, please support me in this matter. What we would like to do, my community and me, we're trying to get funding. It's not an easy thing to do. We're trying to get money to get staff so that we can go out there, because we believe that if we, from the same background with those women, we approach them, it will be easy to get the message across, because sometimes we got our women, the members of our community, they complain sometimes about health visitors not approaching them in a proper manner. So we believe that it will be easy to approach them and easy to get the message across. Right, my conclusion is a bit long. I haven't got enough time. I hope you take this with you and read it. And if there is any question, please catch me after this and I will explain more. Thank you.
My name is Joy. I'm the chairlady for LIHIV, Life After HIV. And we are two groups that integrated, come together, strong together, and LIHIV to just air our voice. And I believe we are actually on the right platform, because we've got the professionals and we've got people from the communities who are saying, hang on, this is the life that we are living and this is who we are. My mother used to say, you cannot say much about flying a plane if you've never been a pilot. Although it is good to have knowledge from the books, but if you've got a pilot, it is better to use the pilot to share that his own personal experience of flying the plane. So in our group today, we are, some of us infected and some affected, and we want to share this from our own life experience of how it feels to live with HIV virus in the UK as an immigrant. So before I go any further, I'll give you the first speaker, who is Patience.
The moment you open up to say that you're HIV positive, you then pass to one dentist after the other. Nobody wants to deal with you. We want to be treated equally with dignity, respect, and respecting our confidentiality, challenging prejudice wherever it occurs. We feel HIV should become a routine test. As asylum seekers, as we come into the country, when we're directed to a GP, we go through a series of tests. So we were hoping that HIV should be part of the test as well, so that it is detected at an early stage and treatment can be started at an earlier stage as well. And it also helps to stop the spread of HIV.
People who have the virus are more at risk of catching other infections from other people than them catching the virus from people who are infected by the HIV virus.
We have been refused fertility treatment, adoption and fostering. We feel that we do not have the right to family life. I'm going to now hand you over to my colleague Nicole and she will explain in more details to you. Thank you very much.
Thank you. I've been HIV for 13 years. Luckily I knew at the beginning that I found out earlier, and I'm still well right now. Sorry for my English, I speak French as well, the lady said. I had a fertility problem, and I went for fertility treatment. I was refused because I was HIV positive, and I tried for an adoption, was turned down. I tried for fostering, I was turned down. So it was really stressful, as in marriage for 13 years without children, as you know, for something that you can get help and being refused by the government. When I say government, I mean practitioner, because the doctor refused me IVF treatment. I went to a dentist and refused treatment, had to be referred to a specialist, HIV specialist for who deal with people who are infected with HIV. And I believe that I couldn't lie that I wasn't HIV. I had to tell the dentist that I was HIV in case for others not to be contaminated of it. Well, that's all I can say.
I think with what we just heard, there is a call for us as a nation to raise awareness on this HIV and AIDS. Why is it so easy for us to talk about cancer? Why is it easy for us to talk about chlamydia and we don't want to talk about HIV? And I'm told that it's an all life term. I'm going to live with HIV for the rest of my life. Why can't you accept me as I am? Why can't I have the rights that a cancer patient has? So as long as the HIV clients do not have the same rights, we will continue having people remaining anonymously. And we, as a community, we have put up our voices together, and we have said together we will stand. Together we will ask the professionals, them that can help us to make our voice heard. The resources are very limited. Therefore, we are saying we'll be signposting them to you, but then signpost them back to us, because we are the community. We know how it feels to become a migrant who is HIV positive, who has lived with this virus. You cannot change the circumstances. This is who I am. I am going to live with it for the rest of my life. Therefore, let's live together and know that there is a life after HIV diagnosis. The problem is people were told, there were some adverts where the graves were opening and people were just so scared about HIV and AIDS. So we have had a good testimony of 13 years. If I were to call everybody to tell us about their life experience, some have lived with the virus for 20 years, 13 years, that's a lifetime. So please, our appeal is help us. Help ourselves, help our communities. How can we tackle HIV and AIDS? When we go for the TB screening, can we have this HIV screen? Because the earlier I know about my HIV status, the better for me. The earlier I get the treatment, then the longer life I live. Thank you very much.
Well, thank you very much for describing the experience, and I'm really grateful to you. Thank you. Our next speaker, before we break out into our panel discussion, is Michael Swarfield of the Asylum team, and it's titled Getting What's Needed in Place.
Thank you. It's quite humbling to follow the previous speakers. I'm based in Leeds, but my remit covers the whole of England, and I'm, as you've been told, based in the Department of Health. What I want to do today really is to tell you about some work that is currently underway. Later in the summer, the